Dental manifestations in Duchenne muscular dystrophy. Oh, hello there. Hi, Zane. Sorry to interrupt. No worries, I'm just getting a cleaning done. How are you? I'm great. What a nice smile. I can see those pearly whites from a mile away. This is Zane. He is a 13-year-old boy and is at his dentist's appointment. Zane is having a routine cleaning done, and he is getting informed on how to care for his teeth. Zane has a disease called Duchenne muscular dystrophy, or DMD. This is a genetic disease that is X-linked recessive, and it causes a mutation in the gene that codes for a crucial protein called dystrophin, which is a structural protein involved in muscle contraction and stability of muscle cells. Because of the muscle weakness, increased muscle injury, and reduced muscle mass that are characteristic of DMD, this young boy and other boys with DMD experience dental challenges and issues with hygiene, bite, gums, and tooth decay. DMD is one of many diseases that extensive research has gone into. By understanding all aspects of DMD, the field of healthcare can drastically improve, providing a holistic approach to treatment and care to provide a life to a young boy who seeks to achieve his own aspirations. In this video, we will explore the dental health of patients with DMD and what potential healthcare treatments we can implement to aid these patients in having a healthy smile that radiates from within. The dental effects that DMD has on young boys is not always a topic of focus. As a crucial passageway for food, speaking, breathing, and most importantly, smiling, the mouth is highly important, and this is one of many challenges these young boys overcome every day. Let's focus on what exactly happens to the mouth and craniofacial structures in patients with DMD. Researchers have discovered that muscles are involved in the growth and development of the craniofacial complex, such as the muscles that control chewing and facial expression are those that are affected in these patients. From what we know about DMD so far, it makes sense that the muscles of mastication are affected and become weaker. The facial morphology, functional aspects of dental occlusion or misalignment, and dental hygiene are primarily affected by DMD. In one study, dental casts of DMD patients had a higher prevalence of malocclusion, with more anterior open bites where there is lack of overlap between the maxillary and mandibular incisors, and posterior open bites where there's a lack of contact between the maxillary and mandibular molars when they bite down. The bite force of the posterior teeth of DMD patients is also reduced. As the disease progresses, the mandibular arches of patients progressively become wider and the distances between the molars increases. These malocclusions occur from weakness in the muscles of mastication and perioral muscle groups. The tongue becomes enlarged and its motility is reduced. Breathing is affected as well due to progressive oropharyngeal and hypopharyngeal weakness. Tongue thrusting is common in these patients, as the tongue muscle may be difficult to control, especially when swallowing, which leads to incisors proclining forward, issues with speech, and inability to move food around the mouth. Mouth breathing is common, as it may be easier and less straining on the facial muscles, but over time, it can cause sleep apnea during sleep and more severe bite deformities. Poor fragmentation of food also occurs because of weakness while chewing, and this combined with poor pharyngeal strength can increase difficulty in swallowing. Because of these malocclusions as well as overall muscle weakness in the face, patients with DMD may find it increasingly difficult to maintain proper dental hygiene, even when aided by a family member or a caregiver. It may be painful and difficult for the young boy to open his jaw or move his tongue out of the way. Plaque buildup, tooth decay, and poor gum health all may eventually arise. In order to prevent worsening dental issues, dentists usually increase topical fluoride treatments, fissure sealants to prevent future cavities, and frequent deep cleanings at the dentist. In hopes of improving the treatment and diagnosis of DMD as a whole, research has been going into orthodontic treatment to improve dental issues of patients with DMD. One study focused on a 22-year-old patient with Duchenne whose skeletal maxillomandibular measurements were severely altered, with posterior open bite and an enlarged tongue. The study sought to treat these malocclusions by extracting all third molars and one occurrence of a small fourth molar, reducing tongue volume, closing the anterior and posterior open bites, and increasing the incisor display when he smiled. Orthodontic appliances were used, both fixed appliances to allow for proper movement of teeth and elastics to align the arches. After 21 months of treatment, the bite and alignment of the teeth had drastically improved. This is fascinating. So how can we help in improving the care of DMD holistically by contributing to improvement of dental care? Well, first of all, there should be early intervention and education. Beginning dental care early, ideally as soon as after diagnosis, will establish good oral hygiene habits. Patients should be educated, caregivers should be educated, as well as healthcare providers about the importance of dental care and DMD management. Also, there should be regular dental visits that should be scheduled every 6 months or as recommended by the dentist, which allow for early detection and management of dental issues. Dental facilities should be accessible as well for the DMD patients, including wheelchair ramps, accessible bathrooms, and equipment to accommodate mobility limitations. Preventative care measures should also be emphasized, such as regular brushing with fluoride toothpaste, flossing, and use of mouthwashes to maintain oral health and prevent dental problems. There should also be customized treatment plans, which should be developed based on the patient's specific needs and abilities. Factors such as muscle weakness and limited mobility and potential respiratory complications should be considered. Patient comfort should be prioritized as well. During dental visits, supportive seating should be provided, breaks should be allowed during procedures, and communicating effectively with patients and caregivers will maximize dental care of DMD patients. So, Zane, how are those teeth feeling? Looks like you got some braces on. They're perfect. I can't wait to show all my friends. Patients like Zane are growing young boys that want to accomplish their goals and experience life to the fullest. As future healthcare providers and researchers, myself and other students can make a difference through compassion and understanding patients, recognizing them beyond their illnesses, but also fostering holistic care for those illnesses. The field of dentistry is a crucial part of the medical field, as the mouth and its structures are just as important as any other physiological structure. The work of dentistry and orthodontics seeks to achieve a functional and harmonious bite for patients for proper function. By learning about aspects of treating DMD, such as through dental work, we can increase our ability to alleviate disease through our work. By developing our knowledge, we can develop our perspectives and further understand the challenges these patients face and help them navigate these challenges. I hope that by increasing my knowledge and understanding medicine in all aspects, I can make a difference and bring hope to the lives of my patients. Thank you so much.